This conference will now be recorded.
Okay, good morning, everybody. Is my voice audible?
Yes, sir.
Okay. So we will start class. So we'll continue today class on snakes, animal poisons, organic irritant animals. So we have looked into different types of snakes and how to identify these snakes. So we have cobra, king cobra, where a spectacle mark, a hood is present, and then we have seen cobra where spectacle mark is not there, and then we have um, viper where diamond shaped spots are present, 3 rows of diamond shaped spots are present on the back, and then we have uh, crate having horizontal stripes, and then so like this we have seen how to identify grossly. And then we have seen the difference between a poisonous snake and non-poisonous snake based on the belly scales, where if the belly scales are covering the entire ventral aspect, then it is a poisonous snake, and if it is they are not covering the entire ventral surface of the snake, then it is a non-poisonous snake. So these are some of the silent features we have seen. Today we will look into the symptomatology and the treatment aspect of the snake bite poison. So we call it as ophitoxemia. Ophitoxemia means poisoning by the snake venom. And what are the signs and symptoms of this poisoning? They depend upon the nature, the location, and depth and number of bites. Um, So nature of bite, it can be a means a complete bite, or it can be also an incomplete bite where instead of both the fangs, only one fang is hitting the person. And then the location is also important. So whether the more the vascular supply, the area, then the more spread of the venom will be there to the body. And then the depth and the number of bites they also include. So the more the deep the bite is, the more absorption quickly into the body will occur, and then the more the number of bites, the more the amount of poison that is injected into the body. The amount of venom injected is also important. So the more the amount of venom, the more the symptomatology of the poisoning. And the species and the size of the snake is also important. If suppose if the size, if a small snake bites, then the poison may not be that much effective. And the species also, so there are, we know that there are some very poisonous snake and then non-poisonous snakes. So most of the bites are, most of the time, they are non-poisonous. So about three-fourths of the bites of the poison snake bites are non-poisonous. And then, and also pathogens in the snake. So what are the pathogens that are present in the mouth of the snake? So when they're biting the animal, definitely the pathogens also they're injecting inside the skin of the human, and then they can cause more spread of disease and more widespread uh, necrosis of the localized tissues. and the extent of anger or fear that motivates snake. So this is also very important. The more the person makes the animal angry, the more fearful the bite will be. So normally snakes are use the venom for hunting, hunting for prey, and not as a anything, but only if the snakes fear for something, then they will use it for a defense. So poison in snakes is for hunting the prey. So the extent of anger and fear is what motivates uh, the snake to bite and inject venom more. And the conditions of the fangs and venom glands also very important. Whether it is, there is a wet bite and a dry bite is also there, where even though the venom, the snake bites, it may not inject the venom inside the body, so that is called a dry bite. And then age and size of the victim is also very important. Extremes of age, the symptomatology is more. If an adult person is bitten by a snake, then the symptomatology is less because of his improved immunity. And then victim's sensitivity to venom is also one factor. So if a person, because venom is nothing but a protein, a toxic protein, so a person who is sensitive to this protein has the symptomatology and more shocking. The symptoms of shock will be more easily attained, and then they're prolonged. And then what is the time after snake bite that we are engaging the person to first aid? So all these factors are there which influence the symptomatology of snake bite poisoning, and we call this as ophitoxemia. The terminology we use is ophitoxemia, which is nothing but poisoning by snake venom. Poisoning by snake venom. So the most common symptom following snake bite is fear or fear of death. So if anybody was bitten by a snake, so the number one symptom that will come is immediately is the fear, which is the fear of death. And the most common inadequate venom is injected, and most of the snake bite cases are due to non-poisonous snake. So the problem with humanity most of the time is fear of death, but we know that almost three-fourths of the bites are non-poisonous bites. Only one-third are poisonous, and then in that poisonous, the one who, no, the snake which is biting may not be poisonous, and even if it is a poisonous, it depends upon whether it is a dry bite or not, whether it is a nocturnal bite or a diurnal bite. If it is a nocturnal bite, again, the venom may be more, because most of the snakes are nocturnal animals, uh, which use the venom for hunting the prey. So there are many factors which will drive a person to fear, but in actual, uh, there is no need to fear. So this comes as a doctor, the role to comfort the patient and then reassure the patient who comes to the casualty. And general symptoms due to fear, our victim may become semi-conscious with cold and clammy skin. He may experience hypotension, pulse will be feeble, and breathing will be rapid. And then a patient will land in psychological shock. So these are some of the symptoms of fear. There can be tachycardia, hypotension, so and he become loss of consciousness. So next, cobra bite. So cobra bite, as we know, it is a neurotoxic poison. Cobra bite is a neurotoxic poison, so it will produce neurotoxic symptoms. fatal dose is 12 mg, and then fatal period is half an hour to 6 hours. Fatal dose is 12 mg and fatal period is half an hour to 6 hours. And there are two types of symptoms, local symptoms and then systemic symptoms. The local symptoms at the site of bite, they occur within 10 minutes, within 6 to 8 minutes, where at the bite site, the patient can develop a reddish wheal and it can be tender, and then a radiating burning pain will occur in case of cobra bite, and then oozing of blood stained fluid. So oozing of blood stained fluid, radiating burning pain, and then reddish wheal which is tender is the localized symptoms of cobra bite. So reddish wheal, tender, radiating burning pain, and oozing of blood stained fluid. What are the systemic symptoms of cobra bite? They occur within 30 minutes, whereas localized symptoms occur within 10 minutes or 6 to 8 minutes. So systemic symptoms are the patient feels sleepy because he is little bit slightly intoxicated, and also it is with added psychological shock. There can be weakness of legs. Ptosis, very important second point. Ptosis is the earliest manifestation, followed by ophthalmoplegia, which is nothing but weakness of extraocular muscles. See, ptosis is drooping of the eyelids. So ptosis is the earliest manifestation, followed by ophthalmoplegia is because of the weakness of the eye muscles. Weakness of the eye, the muscles is known as ophthalmoplegia, and then there can be weakness of intraocular or extraocular muscles can also be there. So the earliest manifestation of neurological symptom is ptosis, followed by ophthalmoplegia. And then another symptoms are there can be excessive salivation, headache, vertigo, paresthesias around the mouth, paralysis of the facial muscles, palate, jaw, tongue, neck muscles, and then difficulty in speech and swallowing can be there. And respiratory arrest due to obstruction of the upper airway or due to paralysis of intercostal muscles and diaphragm can be there, and paralysis completes in 2 hours. Coma, cessation of respiration, and heart will occur. So these are the symptomatology. The patient will die because of the paralysis of respiratory and cardiac arrest. So respiratory muscles are paralyzed not because some that defect in the lungs, because the nerve supply that is going to the lungs, to the heart, are affected, and then because it is a neurotoxic, it will be inhibited, the action will be inhibited, and then way the respirations and the cardiac activity will be stopped. So this is the main symptomatology of neurotoxic. Localized symptoms where there is burning, radiating pain, this tenderness, wheel reaction there, and then blood fluid with the blood mix will be oozing from the bite side. And then symptomatology, there is ptosis, there is ophthalmoplegia, which is the earliest manifestation is ptosis. Excessive salivation can be there, vertigo, headache, and then tingling, paresthesias around the mouth, and then paralysis of the facial muscles can be there, palate, jaws, and tongue. And then there is respiratory arrest due to obstruction of the upper airway or due to paralysis of the intercostal muscles or diaphragm. Next one is crate bite. Crate bite, fatal dose is 6 mg. Symptomatology similar to cobra bite, where there is a localized symptoms and then there are systemic symptoms, but no swelling or burning pain at the site of bite. In cobra bite, there is a wheal at the site of bite, means there is some elevation, there is some swelling, and then there is burning, radiating burning pain at the bite site in case of cobra bite. Whereas in case of crate bite, there is no burning pain at the site of at the burn site. at the bite side, and there is no swelling. And here, regarding systemic symptoms, convulsions are mild in cat bite, and then intense feeling of drowsiness and intoxication can be there. And then here there is albumin appears in urine, which is another systemic feature of crate bite. So grossly, the symptomatology of crate bite and the cobra bite are same. Both are neurotoxic poisons. Both have local effects and systemic effects. The local effects of cobra bite is more of pain and then oozing and then swelling. In crate, there is no pain, there is no swelling, and then symptomatic systemic symptoms. There is more of ptosis, ophthalmoplegia, and paralysis of extraocular muscles in case of cobra bite, whereas in crate there is another non-specific symptoms like convulsions are not severe in case of crate bite, and then there is shock symptoms like drowsiness, intoxication, and one more feature is albumin appears in the urine samples. Viper bite now. So viper bite is a hemolytic poison, hemotoxic. Viper bite is a hemotoxic or vasculotoxic. How to remember is you can remember V for V. V for V, V is vasculotoxic. So viper bite, vasculotoxic or hemotoxic or hemolytic poison. What is the fatal dose? Fatal dose is 15 mg. Fatal period is 1 to 2 days. Fatal dose is 15 milligrams and fatal period is 1 to 2 days. In 50% cases, venom injected is minimal, so symptoms are mild and death also rare due to viper bite. So here, what are the local symptoms? The local symptoms are very prevalent and prominent in case of viper bite. There is redness, there is swelling, they are very painful and persistent bleeding from the site, and then you can also see blister formation in 12 hours. So there is redness, there is swelling, there is pain present at the site of bite, there is persistent bleeding from the site of bite, and then blister formation can occur in 12 hours. So in moderate cases, there can be moderate severity or moderate symptomatology. Feeling of intense pain can be there with giddiness, vomiting, abdominal pain, and then dilatation of the pupils are present. Dilatation of the mydriasis is present in case of hyperbite. Dilatation of the pupils, and then photophobia is there. And the site of bite is swollen, red, painful, but not tender. Painful but not tender. If suppose painful means it will ache, but if you press the area, it may not be aching. It may not feel as if there is pain, but the wound will pain. So painful, but it is not tender. 10 to 15% cases show extensive necrosis of the skin. So this is a very important feature of viper bite, where there is a necrosis of the tissue at the bite side. Necrosis. So extensive necrosis of the skin, subcutaneous tissue, muscle, followed by there can be epistaxis, means bleeding from the nose, hemoptysis, coughing of the blood, intracranial hemorrhages, bleeding into GI and GU, genitourinary tract, floor of the mouth, tympanic membrane. So almost all the soft tissue organs or wherever there is opening, there bleeding can occur. So bleeding can occur from the nose, bleeding can occur from the mouth, bleeding can occur from the ears, from the GI tract, from the rectum, so from the urine, so intracranial hemorrhages. So all the openings can have the bleeding symptoms because of the excessive necrosis and then because of the hemolytic nature of the poison of viper bite. So shock and coma can occur within 2 hours because of the loss of blood and leading to hemolytic shock. In severe cases, shock is a constant feature in both moderate, mild, and severe cases. In severe cases, hemoglobinuria, where after, because viper is a hemolytic toxic, it will break down the hemoglobin of the RBCs, thereby it will be there in the blood and then it will come into the urine. So hemoglobinuria, where presence of hemoglobin in the urine is found due to intravascular hemolysis. So there is breakdown of RBCs inside the vascular system, and then these can be seen in the urine. And sugar and protein are also present in the urine. Coagulation time is increased, leading to bleeding from the gums, rectum, site of bite. So coagulation time is CTBT, bleeding time and coagulation time is increased in viper bite. And then petechial hemorrhages are common, and then here the blood will not clot because of the hemolytic nature of the viper poisoning and because of the increased coagulation time of the clotting system. So there is increased respiratory depression, blurring of vision, headache, dizziness, and paralysis does not occur in viper bite. Whereas in case of cobra bite, in case of kite bite, we can see the paralysis of the facial muscles, palate, tongue can be seen. Whereas in case of viper bite, there is no paralysis can occur. And then renal failure is a frequent complication because of a hemoglobinuria, because of the intravascular hemolysis. The urine will be brownish, reddish in color. So there is frequent renal failure, and then death is due to shock and hemorrhage. So these are some of the brief symptomatology. So cobra feature, there is wheel reaction at the bite site. There is burning pain at the bite site with oozing of blood colored fluid mixed with the blood. And systemic symptoms, there is ptosis, there is ophthalmoplegia, there is paralysis of extraocular muscles, and then there can be paralysis of the facial muscles. Crate bite, there is no swelling, no burning pain, and the rest of the features can be there. There can be albumin in urine. And then viper bite, local symptoms, there is swelling, redness, and then there is oozing of the blood. And then importantly, there is necrosis, extensive necrosis at the bite site. And further, if you wait, then it can form into blister after 12 hours. And then you can, in moderate cases, they can be uh, uh, necrosis, and then in severe cases there can be hemoglobinuria and intravascular hemolysis. The clotting time is prolonged, thereby the blood will not clot, so the bleeding will occur from the uh, site of the bite and also from other areas, from other openings. The patient can bleed from the nose, from the ears, from the mouth, from the GAT tract. And here in viper bite, there is no paralysis that occurs. And renal failure is a frequent complication of viper bite. So how do we manage a snake bite? So first aid, as per WHO guidelines are, so the aim is to retard the systemic absorption of venom. So the main aim of the any snake bite is to prevent absorption of poison that is injected into the body into the systemic circulation in a rapid way. So preventing the absorption of poison into systemic circulation is one of the main things to buy the time, and also it will decrease the symptomatology and it will decrease the severity of the person subjected to this poisoning. So aim is to retard the systemic absorption of poison and prevent life-threatening complications by immediate transport to medical facility. So whenever a person is bitten by a snake, he should be taken to the hospital immediately and he should immobilized and then he has to be taken to the hospital. So next point two is you have to immobilize the limb that is bitten. So the bitten area of the limb should be immobilized by bandage or cloth as in splint, and tight arterial compression is not recommended. Do not elevate the limb as it accelerates systemic absorption. So the main thing is whenever suppose if the snake has bitten on the back of the leg, so between knee and the ankle. So what to do is we have to take a splint, means take some whatever is available by side. Now definitely there will be a plant, there will be some wood. So take that wood and tie with this wood with a small cloth so that both the joints above and below the bite side will be immobilized. Suppose if the calf, at the area of calf, the bite area is there, bite mark is there, then the knee joint and the ankle joint should be immobilized. So the area above and below the bite region should be immobilized, so that why the aim of immobilization is to prevent again the movement of the leg. If the leg moves, the muscles will move. If the muscles will move, there is more vasculature that is required in order to consume this mobility of the muscles, and thereby more vasculature to the bite side and more systemic absorption. So in order to prevent this systemic absorption, most vasculature to the site, we will immobilize the limb so that the vasculature will be at the minimum, and then the systemic absorption of the poison will be at the minimum. So keep the victim in the lateral supine position and immediately transfer to medical center. So keep the person in supine position and in lateral position, because if suppose if any sudden vomiting is there, then he may not aspirate. So that's why we'll keep in a lateral position and then also supine position, so that you can talk to the patient, you can know what happened. So reassure the victim as 70% of the snake bites are non-poisonous. So this is very important. Reassure. So reassuring the patient is very, very important snake bite because of fear of death. And because of this fear, one more thing is again the systemic absorption of the poison can increase. How? Because of the fear, tachycardia will be there. There is increased breathing. Because of this tachycardia, there is increased blood supply to the bitten area. Because of the increased blood supply, again the vasculature of the bitten area will be increased, and then the absorption of the poison will be increased. So by fearing, the more absorption by sympathetic activity is increased, and then more blood supply and more systemic absorption, so more danger. So that's why reassuring the patient and asking the patient to be quiet and calm is very important to prevent the spread of venom into the systemic circulation. So what are the first aid to be done? So what are the don'ts we have to do? What should not be done in case of snake bite? You should not suck the poison from the bite side. These are the old methods which are seen in movies, but it is not recommended and is also dangerous. So do not suck the poison, because if the person is sucking the poison, if the person who is sucking the poison, if the mouth contains any ulcers or any gaps or any cracks, then the poison can enter through the cracks into the blood supply. Normally, if the poison is swallowed, it may not be dangerous, but if it is injected, then it is dangerous. So a person who's sucking, if the mouth has some ulcers and then through the ulcers, if it is entering the tissues, then he himself will be getting poisonous symptoms. So that's why do not suck the poison or apply any chemicals and medicines. You should not apply any chemicals and medicines. Local incision and suction of the poison is not recommended. There is something where suppose where at the bitten area they will cut, and then thinking that the poison will be drained out if you cut the skin at the site of the bite, but it is not recommended and it is dangerous also. Don't use a tourniquet or apply ice or water. Normally a tourniquet is tied above, between the heart and the bite side. Tourniquet is applied between the heart and the bite side. So suppose if the foot is bitten, then you will apply a tourniquet at the thigh region, and then thinking that the poison spread will be prevented to the heart. But here it is not recommended, it is no use tying the tourniquet. And the other ill effect is it can block the arterial supply, which is very, very dangerous. It can block the arterial supply, and then the patient can land into gangrene of the leg, which is dangerous. So never tie a tourniquet. Only thing is recommended is to immobilize the limb. You should immobilize the limb. Ask the patient not to move the bitten area, and don't cut the wound or attempt to remove the venom. So don't drink caffeine or alcohol, which could speed the rate of which your body absorbs. So even no drinks should be allowed, whether hot or cold, because of increased sympathetic activity and thereby increase of absorption of poison. So management on reaching the hospital. So we have to evaluate the basic management protocol like ABC, airway, breathing and circulation. So normal saline and ringer lactate should be given to every suspected case of snake bite because of psychological shock and also because of the shock, because we know that both in crate and cobra bite and viper bite there is oozing of blood. There is oozing of blood in case of viper bite. There is oozing of fluid mixed with blood in case of crate and then cobra bite. So we have to replace the fluids. So normal saline or ringer lactate should be given. Specific treatment should be started after proper history and then examination, physical examination. History to be taken whether a case of snake bite or not. We have to assure the patient whether the patient has seen the snake or not. Is the species of the snake identified? Because some people they will bring the snake along with the patient, dead or alive. And then you have to find out any brief history of medications, previous medications he is using, whether tetanus vaccine or tetanus injection was taken before coming to the hospital, or what is the last tetanus injection that he has taken recently. Then you have to find out allergy, drug history, allergies, to know whether because the snake venom is a toxalbumin, so the patient can be allergic to any foreign protein. So you have to find out the drug history and allergic history of the patient. So physical examination, look for fang marks, looks for local signs, look for systemic signs, look for edema, swelling at the bite site, look for tenderness, ask for pain, look for any bullae that are present, which are present in viper bite, oozing from the wound, which can be present in the viper bite, cobra and crate bite. PTK are present or not. PTK can be seen in viper bite. So edema can be seen in viper bite. So examine whether these swelling are present at the bedside and if it is progressing, and examine and palpate the draining lymph nodes also. The features of severe snake bite. What are the features of severe snake bite? There is rapid extension of swelling of the bite. There is enlargement of lymph nodes, early tender enlargement of local lymph nodes. There is early systemic symptoms. There is early spontaneous bleeding, especially from the gums, and then the passage of dark brown urine. So because of the renal failure. So rapid extension of swelling of the bite, early tender enlargement of local lymph nodes, early systemic symptoms, early spontaneous bleeding, which is from the gums, and then passage of dark brown urine. So these are the five things which you should keep in mind, which shows that the severity of the snake bite is more in such a patient. So laboratory investigations are of little value, but they are of maybe useful for some prognosis and specific interventions. One thing is clotting time, clotting test. So we call it as 20 minutes clotting test, where we take a venous sample, fresh venous sample, and keep it in a dry glass tube, and then we leave it for 20 minutes undisturbed, and then we will gently tilt it. If the blood is still in liquid state, it indicates viper bite. We know that viper bite is a vascular toxic, it is a hemolytic toxic, it causes clotting time prolongation, so that's why it will not clot. So that's why we leave the blood for 20 minutes undisturbed. By that time the blood should clot if it is normal blood. But if it is viper bite, then the blood will not clot, and then if you tilt the tube, the blood will be still in liquid state. And this test is repeated after 6 hours, and the therapy is stopped after normal clotting time. So this test is used to know whether the treatment is working or not. Suppose if the viper bite is there, so we will first start with this test, and then we know that the blood will be in liquid state even after 20 minutes. After treatment, we will take this blood and again we will see and wait for 20 minutes, see whether the blood is in liquid state or it is clotting. Suppose it started clotting, that it indicates that the patient is responding to the treatment. And then another test is ELISA test. ELISA test is used to identify the species involved based on the antigen and the variant. So very important ELISA test, but it is very expensive. It is not really available in India. So we are not doing this ELISA test in our casualties or in our labs because it is very costly and it is not available in a major villages or towns. Only in the cities it can be available, and then it is very expensive. Every patient cannot be affordable by that. And then we can do also other non-specific tests like ECG can be taken to know the cardiac activity, EEG to know the brain function, serum creatinine to know the kidney failure status, and then prothrombin time, urine analysis. All these things can be seen as a non-specific thing. So treatment aspect, the drug of choice we use in the snake bite poisoning is polyvalent anti-snake venom. Polyvalent anti-snake venom, PAV, polyvalent anti-snake venom is the drug of choice for snake bite venom. What is that? What is this polyvalent anti-snake venom? This is prepared at Hopkins, three institutes in India: Hopkins Institute, Mumbai; King's Institute, Chennai; and then Serum Institute at Pune and Kasali. So these are the three institutes which prepare polyvalent anti-snake venom. What is this anti-snake venom contain? It is prepared from the venom of four common poisons: cobra, kite, Russell's viper, and sask-tailed vipers, because these are the four snakes that account for more than 60 to 70 bites in India. So that's why they used the venom of these four snakes: cobra, crate, Russell's viper, and sask-tailed viper, and they prepared a polyvalent anti-snake venom so that most of the bites can be relieved of this antidote. So usefully when given within 4 hours, very important. So when it is effective, it will be effective when given within 4 hours. So that is very important that the patient should be shifted to the medical facility within 4 hours of snake bite, so that he can be saved by giving this polyvalent anti snake venom. So it is available as a powder form, lyophilized powder form. So you have to mix it with water to make it a fluid, and then you have to give it with normal saline into the body. So it is available in lyophilized powder solutions. Solution powder mostly is available in powder form only. And then one ampule, it neutralizes about 6 to 8 milligrams of venom. So one ampule or one bottle will neutralize about 6 to 8 milligrams of venom of snake. So this is the snake venom anti-serum, a polyvalent anti-snake venom. So treatment is, it is used by diluting in a 500 ml of distilled water and or normal saline, and given slowly IV over a period of 1 hour. So very important. So I told you this is in a powder form. So you have to mix it in water and then make it liquid, and then this liquid is injected into a normal saline bottle about 500, and then this normal saline bottle is injected through the IV line slowly for 1 hour. So minimum symptoms, there can be local swelling only up to 5 Ls. So these polyvalent anti-snake venoms can also cause some reactions, some allergic reactions in the body. So you have to observe whether any reactions are there or not. So minimum symptom is only local swelling can be there. Moderate symptoms, swelling progressing beyond the site of bite. With the systemic symptoms, then we have to give 10 vials. In minimum symptomatology of poisons, 5 vials are sufficient. In moderate symptomatology of poison, then 10 vials should be given where there is swelling at the bite site and then there is systemic symptoms. In case of severe symptoms, where there is marked local and systemic reaction, then we can have to give about 10 to 15 vials of anti-snake venom. So if there is mild poisoning of the snake bite, 5 vials. Moderate poisoning of the snake venom, 10 vials. If there is severe poisoning by the snake bite, we will give 15 vials. So dose is same for children and adults. There is not contraindicated in pregnancy, very important. So even in pregnancy, it can be given. In neurotoxic poison, second dose of 10 vials after 1 hour can be given. For signs of neuroparalysis, give neostigmine intramuscular with atropine IV. So we know that cobra bite causes ptosis, it causes ophthalmoplegia, it causes paralysis of extraocular muscles, it causes paralysis of the facial muscles, it causes a paralysis of the palate, tongue. So in order to reverse this paralysis, we can give neostigmine intramuscular along with the atropine intravenous, and then we can give heparin 1000 to 5000 international units for clotting abnormalities. Heparin can be given, and then TT should be given, tetanus toxoid, either initial dose or booster dose, because definitely it is a outside bite, it is not a clean bite, so we have to give a TT. And broad spectrum antibiotic should be given if there is a severe tissue involvement at the site of bite. So mostly we know that there is extensive necrosis occurs in case of viper bite. So in that case, you have to give a broad spectrum antibiotic. And then mechanical ventilation is if respiratory paralysis occurs in case of cobra bite. And then fluids and blood plasma transfusions in severe poisoning cases can be taken. And then paracetamol can be given for pain relief, but not aspirin. Aspirin should not be used because aspirin will aggravate bleeding. So that's why aspirin is cannot be given in a snake bite, and whereas paracetamol can be given for pain relief. So adverse reactions of anti-snake venom is these three types. So we know that anti-snake venom has benefits, huge benefits if it is given within 4 hours of snake bite. But what are the adverse effects, side effects of anti-snake venom? You know, the patient can have anaphylactic reaction, which is it can be early within 10 minutes to hours of the start of therapy. It can be there can be itching, there can be urticaria, there can be dry cough, nausea, abdominal pain, diarrhea, tachycardia, bronchospasm, and angioedema. So these are the anaphylactic reactions that are seen in an anti-snake venom thing. And then the patient can also have pyrogenic reactions where fever with chills, rigors, and hypotension can occur within 1 to 2 hours. And then the patient can also have the late reactions, otherwise called as serum sickness type, which develops about 1 to 12 days after the treatment. So early anaphylactic reaction develops within 10 minutes. Pyrogenic reactions develops within 2 hours, 1 to 2 hours, and the late reactions, which are serum sickness type, develops within 1 to 12 days. And then in serum sickness, the patient can have fever, nausea, vomiting, diarrhea, itching, urticaria, lymphadenopathy, nephritis, immune complex nephritis, arthralgia, myalgia. So these are generalized systemic symptoms. So, so fever, nausea, vomiting, diarrhea, itching. So these are some of the late reactions of serum sickness type developed in 1 to 12 days. So how to deal with these adverse reactions is we have to stop polyvalent anti-snake venom infusion, and then you have to administer adrenaline 1 is to 1000 adrenaline, and then you have to repeat it in 10 to 15 minutes if there is no improvement. And polyvalent anti-snake venom is resumed after controlling these allergic reactions. So for late reactions, serum sickness, oral antihistamines like chlorpheniramine maleate can be given. So adrenaline is the treatment of choice for adverse reactions for anti-snake venom effects. So PM changes and then some of the other things, myths and scorpion bites, we'll see in the next class. So thank you for your patient listening. We'll continue in the next class. Thank you. Thank you very much. You can leave now.